Hello everyone, you're listening to Dr. Huma Ibrar, and today we are going to talk about how to make your diagnosis easy by knowing the type of pain, the characteristic of the pain, and the pathophysiology of that pain. But before starting, subscribe this channel and don't forget to click the bell icon. So let's move towards the topic. In this video, we'll talk about the axial pain plus the referred pain and radicular pain, plus also we will talk about the radiculopathy. Talk about the characteristics of pain plus the pathophysiology of the pain. So starting with the axial pain. Let's talk about the characteristics of the axial pain. So the characteristics of axial pain are dull, deep, aching, plus localized. So these are the four characteristics of the axial pain, including dull, deep, aching, and localized pain. So let's talk about the pathophysiology of axial pain. Pathophysiology. So stimulation of the nerve ending within the structure So this is the stimulation of the nerve endings within the structure that is also the source of pain. So this is the pathophysiology of axial pain. Moving towards the referred pain. Talking about characteristics of the referred pain. So same, dull, deep, like the axial pain, aching. Same like characteristics of axial pain, dull, deep, aching, but difficult to localize. So this is the main difference between the axial pain and the referred pain. Moving towards the pathophysiology of the referred pain. So the brain has difficulty to distinguish the true source of pain. When efferent nerve fibers from two separate sources converge, and so pain is perceived in multiple areas. So this is the pathophysiology of referred pain plus characteristics of referred pain. Moving towards Radicular pain. Let's talk about the characteristics of radicular pain. So the characteristics of radicular pain include lancinating pain, shooting pain, electric shock-like pain, plus the last one is band-like pain. So these are the 4 characteristics of the radicular pain. Moving towards the pathophysiology of radicular pain. Characteristics and the pathophysiology. Compression of dorsal root ganglion or inflammation of nerve root. So this is the pathophysiology of the radicular pain and characteristics. Moving towards the last one, that is radiculopathy. We'll talk about the characteristics of radiculopathy plus pathophysiology of radiculopathy. Talking about the characteristics of radiculopathy, that include weakness, numbness, tingling, decreased reflexes. So these are the 4 characteristics of the radiculopathy. Moving towards the pathophysiology, the pathophysiology of the radiculopathy is ischemia or compression of nerve root. So these are the characteristics and the pathophysiology of the radiculopathy, and that's all for today. Thank you for watching this video, and remember me in your prayers.